the central vein sign is at the current time still a research tool that is being touted as potentially an imaging finding that may be a very useful biomarker for diagnosis in MS. And so the reason why this sign potentially may almost be ready for prime time use is because it can be pretty easily acquired on most regular 3 Tesla MRI scanners. The sequences that you use don't require an inordinate amount of time. Some of the specialized sequences you do need special permission for, but that's pretty easily acquired, and it doesn't take too much training to be able to easily identify the sign. And so as you heard in this prior session on precision medicine and diagnosis, as well as the symposium this morning, there are a number of groups that have assessed the value of the central vein sign, and it seems like a very specific imaging biomarker for MS. So it would be useful in very early stages of diagnosis because it would prevent people from being misdiagnosed. And, thereafter, obviously, preventing misdiagnosis is very useful because it prevents people from being treated with medications that they don't necessarily need to be on. So there's a lot of clinical utility, and I think of many of the imaging measures that were discussed, it probably is closest to being ready for prime time use. So we in Toronto have a cohort of people with radiologically isolated syndrome, and essentially what this is a group of people that have MRI findings that look very similar to what we see in people living with MS, but they don't have any clinical symptoms. So it's a very valuable patient population to study just because it may give us insight into the very earliest stages of MS and what causes MS, how it propagates, and therefore it will allow us eventually to develop better treatments. We use these special sequences in our RIS patients to look for the central vein sign, and what's interesting is that the vast majority of people have many lesions with central veins. In our cohort, over 90% of patients met the 40% threshold that has been proposed to distinguish MS from other white matter diseases. So it's a very interesting finding because, number one, it's never been assessed in RIS before, but what this tells us is that people with RIS, despite the fact that they are asymptomatic, do have lesions that have formed from perivenular inflammation and demyelination. And so we do think it may eventually prove to be of utility in RIS as a prognostic biomarker, meaning that it may be that people who have larger proportions of lesions with central veins are at much higher risk of eventually converting to MS. And obviously there's a lot of clinical utility in being able to tell if someone is at high risk from the early stages or not, just because it has treatment implications. So, MRI in general has played a really important role in MS over the decades. So it's allowing us to diagnose patients very quickly. And there are MRI measures, even using typical clinical grade MRIs, that help us to prognosticate how an individual will do. And that's a huge need in MS clinical practice because one of the challenges of the disease is how variable it is. So you never really know in somebody who is presenting in front of you for the first time how that person will do in the next 10, 15 years. And that's really important to know early on because obviously it influences what sort of treatments you will initiate in a particular patient. And this is where imaging has the potential to play an important role. So as I said earlier, conventional MRI techniques already play a role, but the measures that we use are still pretty crude and not very good at exactly defining how a certain patient will do. Some of the more advanced techniques that we have, including techniques like diffusion tensor imaging, magnetization transfer imaging, susceptibility-weighted imaging, all of these techniques are able to interrogate the brain and spinal cord in much more detail. So it gives us information on what's actually happening in the tissue. And this can be very useful, if studied in enough patients and we know what the appropriate thresholds are, to give us an idea of how a patient's central nervous system's health is in front of you. And the reason why that would be helpful eventually is, again, it will help us to tailor treatments to individual patients, which is essentially what precision medicine is.